As you will already know, healthcare organizations of all kinds will constantly encounter children and young people up to age 25, either directly or indirectly. As a result, the organizations and the people working in the organizations will have the potential to create a positive or negative impact on those children and young people. Your aim as health professionals will be to always make the impact as positive as possible. All health professionals and health-related organizations are under constant pressure to do more with less. However, fully embracing the UNCRC articles need not be onerous, and you are likely covering most aspects already. For one-to-one interactions with children and young people, the next step may be as simple as taking some time to put yourself in the shoes of the child or young person when entering your environment. You are comfortable within your environment and the processes which go on there, but the child or young person may be scared, overwhelmed and confused, even as a visitor. The adult world can be a scary place for children and young people. How might they be feeling? What might they be thinking? What could you do to improve their experience? Consider some basics. Do they feel safe? Do they have a voice and are they listened to? Is their privacy protected? Is the environment you are placing them in or leaving them in suitable? When you explain something to a child or young person, are you giving them enough information, and is the information in a form which can be fully understood by the child or young person? Do you perhaps use too much jargon? Are they scared to ask questions? Do they feel listened to? Are you really listening to them? What can you do to put them at ease and provide opportunities for them to have their opinions heard? At the organizational level, there are also many best practice examples being designed and used right now by health-related organizations, just like yours. An example of this best practice is the Abertawe Bro Morgannwg University Health Board Children's Rights Charter. Based on the UNCRC, the charter was developed in partnership with children's rights professionals, children and young people. The 10 themes of the charter are based on the UNCRC and demonstrate a commitment from ABM-UHB that all staff will protect and respect children's rights when they are accessing services. There will be a link to the full charter at the end of the video. Consider introducing a youth advisory panel or a young person's forum of some kind. They give children and young people the opportunity to express their opinion and have their voices heard on health-related matters. These participatory groups can provide you with a wonderful resource, and the solutions they develop may in turn improve experiences of services for children and young people. One of the key themes of the UNCRC is protection for children. This is clearly highlighted in UNCRC Articles 32, 34 and 36 amongst others. Through fully enabling children's rights as detailed in the UNCRC, organizations will be clearly meeting their obligations of safeguarding the children in their care. Fully involving and working with children and young people by listening to them and asking rather than telling, as well as sharing best practice with other health-related organizations, will be key drivers of your success. What opportunities can you identify to embrace the UNCRC principles to create a positive and empowering experience for the children and young people who interact with you in your organization? To view the full ABM-UHB Children's Rights Charter, please follow this link.